Do not DIY your own freckles. I'm a real plastic surgeon and I'm gonna react to DIY plastic surgery on this video today. You will be very surprised at what some people are trying to do to themselves to look better cosmetically. And it's more than just DIYing freckles. You gotta take a peek at the last one. Ooh, this is a hyaluron pen. Ouch. Oh, ow. Ugh. A hyaluron pen is a device that you can literally buy online at like Walmart and Amazon that uses pressurized air to literally inject substances into your body. So some people are actually injecting filler, like hyaluronic acid filler, into their lips in this manner. Now the problem with the hyaluron pen is that you cannot control where that filler goes because it's literally just being shoved into your tissues. It appears that she developed a hematoma, which is bleeding on the inside, like a deep bruise of the tissues. The good news for something like that is it does go away after a few weeks. But the worst thing that can happen with a hyaluron pen is you can accidentally inject that filler into a blood vessel. That can actually occlude the blood supply to parts of your lip, causing your lip to turn black, to die, and to fall off. Yes, you can literally lose parts of your lip.
Bitch, I'm so nervous right now. I've literally gotten bigger in a second.
Well, the good news is that she didn't necessarily do this to herself, and this was probably an allergic reaction, not necessarily that she had too much filler. When we do filler injections in the lips, a lot of practitioners will apply a numbing substance, a numbing cream to the lips. And if you've got an allergic reaction to that numbing cream, this can happen. The treatment is to go to the emergency room and most likely get started on a course of steroids. Steroids can take the swelling down pretty darn quickly and get her lips back to a normal size.
I am leaving a review for the soap that is supposed to help dark spots. I saw that my nose area started to get really red and irritated. So when I spoke to the doctor today, they told me that the soap that I used basically burned my face. And here's my face.
Well, she's not the only person that this type of thing has happened to. Check out this next video. Oh wow, that is really tough. So what's going on is this is called hypopigmentation, specifically post-inflammatory hypopigmentation. If you get inflammation in the upper levels of your skin, and if you've got a lot of melanin in your skin, like these last two people have, then it can actually cause that melanin to be sloughed off and cause your skin to look really light in color like what you're seeing here. The good news is that this does typically go away on its own. So you give it a few months, and especially if you add on maybe some lightening creams or brightening creams to it, that pigment will eventually come back and your skin will get back to its regular color. Or at least that's what we hope happens.
Waking up in the morning, thinking about so many things. I just wish things would get better. I'm trying to get rid of them, but nothing seems to stay the same. Woke up in the morning.
So why can something like this happen to your skin if you're using normal skincare products? Well, one thing you always want to look for is the expiration date of the products that you're using. If your products have expired, sometimes what can happen is that the chemical composition can change and what you're applying to your skin is no longer what it used to be. The other thing that can happen is you can get bacteria that can actually grow in the product. Most skincare products and makeup have some type of preservative that helps basically fight bacterial and fungal contamination and growth in those products. And after a while, those ingredients may not work so well anymore, and you can get more and more growth of bacteria. You then apply that to your skin, you get an infection, you get a reaction like this, and it is not so good. The final thing that can happen is some products can get more and more concentrated. If you have an active ingredient, like let's say an acid, and that has been buffered by other types of ingredients like water and oils in it, and those change in structure or they start to evaporate, then that acid can get stronger, and now you're treating your skin with something much stronger than you thought it was before. So all these things are basically reasons why you should not use expired products on your skin. please do not do chemical peels on your skin at home. We do tons of chemical peels in my office, and we are very careful with the percentage of acid that's being used and making sure that we neutralize that acid so that it doesn't go too deep into the skin. This is only something that a professional, somebody who has been professionally trained in these treatments, should do to your skin. So what happened to his skin? Well, we talked about post-inflammatory hypopigmentation a few videos ago. This appears to be post-inflammatory hyperpigmentation. And this is like what happens if you've got darker skin and let's say you get a breakout, you get a pimple. After that pimple resolves, then you can get a dark spot that can stay on your skin for many months. This is PIH, or post-inflammatory hyperpigmentation. You get the same thing if you're putting an acid on your skin and it burns that skin, it gets inflamed, and now you get buildup of melanin or essentially pigment in that area. So especially if you've got darker skin, you are at risk of both of these things happening if you have too much inflammation of your skin. Hypopigmentation and hyperpigmentation. Neither are all that appealing. So doctors tell you do not pop your pimples because if you do, you can technically push some of that inflammation and that bacteria into the skin, causing you to get a potential infection. A superficial skin infection is called cellulitis, and that can often be treated by taking an oral antibiotic. But when that infection goes deep underneath the surface of the skin, that can be called an abscess. And that's when you get pus that's trapped below the skin. It gets real inflamed, it can get real swollen, and that can be very, very harmful and even dangerous. If you get something like that that happens in what we call the danger triangle or the triangle of death on your face, and this is a triangle that is basically the points are the top of the nose and each corner of the mouth, that has connections to the cavernous sinus, which is very close to the brain, and technically inflammation in this triangle of death can lead to clotting back there, and that can cause even infections going all the way back to your brain. So moral of the story is do not pop your pimples. Instead, use pimple patches. Go to a dermatologist if you want to get your pimple injected with a steroid, or even very simply just put a little band-aid over it and let that pimple settle down on its own. This has got to be the dumbest DIY I've ever seen. So I have no words for the stupidity of liposuctioning yourself, what this doctor's doing. But I do have words for outrageous things that some people are doing with their bodies. Like let's say you take a guy who is quite large, not muscular large, but large, and you give him a six-pack with plastic surgery. Or maybe a doctor saying that your forehead should only be 2 or 3 fingers wide. Take a peek at my reaction to some outrageous TikToks in this video right up here. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.